This is a bill for over $50,000 for a minor, routine procedure. But buried inside the dozens of confusing lines is a so-called mistake that could cost a family their savings, their home, their future. And this story isn't a fluke. It's not some one-in-a-million misfortune. In fact, studies show that up to 80% of medical bills in the United States contain costly errors. Nope, not a typo. 4 out of every 5 bills are probably wrong. The real question is, are these just simple mistakes? Or are you being deliberately overcharged? The line between a clerical error and a business strategy is getting frighteningly blurry. Today, we're pulling back the curtain on the shocking truth behind your medical bill. We'll show you how the system is practically designed to be confusing, how these errors hit some of us way harder than others, and what you can do to fight back against a system that might just be counting on you to stay quiet. So how did we get to a place where getting sick is a financial gamble, and the bill is more confusing than the diagnosis? The answer is a healthcare system that's become a maze of weird incentives and mind-numbing complexity. Let's start with the basics. When you get care, a bunch of codes are generated. They're called CPT codes. Every single thing, from a blood test to brain surgery, gets a 5-digit code. Your doctor sends these codes to your insurer, and the insurer decides what, if anything, they'll pay. You're on the hook for the rest. It sounds simple, but this is where the chaos kicks in. The first layer of error is often just human mistakes. A single typo or a transposed number in your insurance ID can get your claim denied instantly, but it goes so much deeper. We found 2 of the most expensive and sneaky errors are things called upcoding and unbundling. Upcoding is when you're billed for a more expensive service than what you actually got. Imagine going in for a quick checkup, but the biller uses the code for a super long, complex consultation. The result? A much higher charge. When it's done on purpose, it's flat out illegal, but it can be incredibly hard to spot. And with AI getting into the mix, some analyses show a risky trend where automated systems can inflate billing, a practice sometimes called coding intensity. Then there's unbundling. Some procedures that are usually done together are supposed to be billed under one single code for a set price. Unbundling is when a provider breaks that package deal apart and bills for each individual step separately, which can make the final cost skyrocket. It's like ordering a value meal but getting charged for the burger, fries, and drink, all at full price. It's not allowed, but it happens all the time. These aren't victimless mistakes. The scale is staggering. The administrative mess from this broken system, this endless cycle of billing, denying, and rebilling, costs the nation hundreds of billions of dollars a year. Duplicate billing, where you're charged twice for the same thing, is a huge part of that. It's a classic too many cooks in the kitchen problem. Your info passes through so many hands that mistakes are almost guaranteed. And this chaos doesn't just hurt you, it creates huge losses for hospitals too. They lose billions each year to their own coding errors and denied claims. It's a system drowning in its own complexity, and the financial weight always trickles down and often floods the very people it's supposed to be healing. But here's the harshest truth. This broken system doesn't hit everyone the same. The crushing weight of medical debt, often sparked by these billing errors, falls way more heavily on communities of color. And that's no coincidence. It's the result of deep structural inequities that turn a health crisis into a financial disaster for already vulnerable people. Data from the Urban Institute and Kaiser Family Foundation paints a grim picture. Adults in communities of color are more likely to have medical debt in collections. Nationally, it's about 15% in communities of color versus 11% in white communities. But some places show a shocking gap. In Knox County, Tennessee, for instance, an incredible 40% of residents in communities of color had medical debt in collections, compared to just 17% in mostly white areas. Why does this happen? These gaps are tied to a long history of discrimination. Decades of policies like redlining have led to concentrated poverty and a higher risk of chronic disease in these communities, which means a greater need for medical care. At the same time, systemic racism in the job market means less access to jobs with good employer-sponsored health insurance. Even with the Affordable Care Act, Black and Hispanic adults are still more likely to be uninsured or underinsured, and just having insurance is no magic shield. One analysis found that Black households with health insurance were just as likely to have medical debt as non-Black households without any insurance at all. This shows the problem is bigger than just coverage. It points to a system where people of color often have worse insurance plans, face higher out-of-pocket costs, and are hit with more aggressive collection practices. In fact, studies and reports have found that hospitals disproportionately use tactics like wage garnishments against Black patients, literally taking money from their paychecks to settle medical debts. This isn't just about money, it's about health. People buried in medical debt are more likely to skip the care they need, from doctor's appointments to prescriptions. It's a vicious cycle where health problems get worse, leading to even bigger bills down the road. This financial stress digs the racial wealth gap even deeper, making it harder for families to save money, buy a home, or build a future. So when we talk about an 80% error rate, we have to remember that the fallout from those mistakes isn't spread evenly. For some, a wrong bill is just an annoyance, but for others, it's the final push into a spiral of debt and poverty that can feel impossible to escape. This system is a mess, but you are not powerless. That feeling of dread when you open a 5-figure medical bill, that's what the system is counting on. It wants you to be confused, intimidated, and silent. But you can, and absolutely should, fight back. Here's your battle plan. First, never, ever pay a bill without questioning it. The first bill you get is often just a summary with a single, terrifying number. Your first move is to call the provider and demand a detailed, itemized bill. You have a right to see exactly what you're being charged for. Second, go over that itemized bill with a fine-tooth comb. When it arrives, compare it line by line with the explanation of benefits, EOB, from your insurance company. Look for common mistakes. Are there duplicate charges? Charges for meds you brought from home or for a procedure that was canceled? Were you billed for a private room when you were in a shared one? Check the dates. Simple clerical errors are everywhere, and you have every right to dispute them. Third, look at the codes. This gets a bit technical, but it's where the big money is often hidden. Every line should have a 5-digit CPT code. You can look these codes up online to see what they mean. Does the description match the service you got? This is how you spot potential upcoding. If you see a dozen small charges for one event, you might have been unbundled. Question anything that looks off. Fourth, dispute everything in writing. A phone call is a good start, but a letter creates a paper trail. Send a certified letter to the hospital's billing department and your insurance company, outlining every single charge you're disputing and why. Keep obsessive records of every bill, letter, and email. Write down the name of every person you talked to, the date, and what they said. This paperwork is your best weapon. If the debt has already gone to collections, you can send them a letter to dispute its validity. By federal law, that forces them to pause collection while they provide proof. Finally, know your rights. Thanks to the No Surprises Act, which went into effect in 2022, you have federal protection against most surprise bills for emergency services and for out-of-network care you get at an in-network hospital. The law is working. It's already prevented millions of surprise bills, but its rollout has had challenges. If you think you got a bill that violates this act, you can file a complaint. And remember, if your insurer denies a claim, you have the right to appeal. An incredibly small number of people ever appeal denials, yet most who do fight back win. The shocking truth is our medical billing system often feels like it's designed to be a black box. It thrives on complexity and profits when we don't push back. From simple typos to outright fraudulent coding, the deck feels stacked against us. This flawed system squeezes the most out of people who can least afford it, worsening inequality and turning the act of getting well into a path to poverty. But we aren't powerless. By demanding transparency, questioning every charge, and refusing to be intimidated, we can reclaim control. The fight can be draining, but it's a fight we have to have. Your health should never cost you your financial security. If you have a story about a baffling medical bill, share it in the comments. By dragging these stories into the light, we can expose this broken system for what it is. Because let's be clear, you should never have to choose between your health and your future.